Whether you're on the payer side, the provider side, the consumer side, the hospital side, or the outpatient delivery side, everybody has the dilemma of how can you work differently, how can you remove silos, how can you collaborate, coordinate, all of it in the service of serving people.
What we have currently is a system in which the fire hose is on full, and a system that's not quite able to handle all of that rushing water.
Traditionally, healthcare has often been thought of inside of the doctor's office or possibly inside of a hospital, but as a more mature healthcare community, we probably need to think far outside of the walls of a clinical setting.
I once heard it said that seeing the primary care physician or going to the hospital for your health care is about 10% of what constitutes a person's health. The other 90% has to do with how you live your life, and that includes everything from whether you have access to housing, whether you have enough food and nutrition, whether you have a job that can support yourself and your family.
Coordinated care for patients for both mental health services and chronic disease management and medical services is very, very important. It's essential. If you don't coordinate care, there is a very high likelihood that the patient's medical needs will not be met as well.
One of our clients came in and she was not sounding good at all. She was wheezing, she was coughing. She went in for her clinical appointment with her therapist, and her therapist says, "You really need to see a doctor. You sound really, really sick." Then when she came out, our care transition said, "We really need to get you to see a primary care physician." And the client promised, yes, she would. She would go see a doctor right away. That following week, our care coordinators went to check on her. She had passed away over the weekend through the complications of pneumonia. Stuff that could have been easily prevented, something that could have easily saved her life just by having her seen by a primary care physician, but we didn't have the connection or accessibility. That woman was less than 30 years old. She had a family she left behind. And that's why I think it's important that we co-locate services, not only here at Kitsap Mental Health Services, but I think it's essential for the rest of the state of Washington.
I think that the vision of having physical health care, drug and alcohol treatment, and mental health care all integrated together in a payer system that's integrated will help challenge us as nonprofits and as private commercial providers to come all together and look at meeting those needs all at once with the same team approach.
This is the opportunity of a lifetime because it empowers community members to really improve their own health and the health of the community, and it makes our systems work better, right, and actually be more effective. And most of us in the systems really want to be effective.
There's no question that it's worth it in the end. In fact, in the end, it's the only direction that's going to work to improve the health care of the people of the country is to integrate these kinds of care. That's the only thing that holds any promise for really making us healthier as a community.